This is my paper on innovative IOL, which is a rigid IOL, which is polyfocal in nature. So cataract is does not look at anybody as to whether the patient is able to afford or not able to afford for multifocality. Sorry, I'm not able to get this. No, my slides are just moving on its own. So this is my financial disclosure. So this lens is developed by the entrepreneurs, Dr. Ramesh C. Shah from Borivali, Mumbai, Dr. Jagdeep Kakadia, and Dr. Vikrant Bhale of Lifeline Medical Devices. So this IOL was developed with intention of having both near, intermediate, and far distance vision for the patient without the use of principles of refraction and diffraction gratings. So there are no rings. That's how we will be able to prevent the incidence of halos and negative and positive dysphotopsias. So every patient is entitled to have a multifocal vision because cataract doesn't see at anybody whether he is able to afford or not. But most of these multifocal IOLs are manufactured in foldable form and with so many disadvantages. So this is how the vision is seen in this polyfocal IOL with no evidence of positive or negative dysphotopsia. So this was developed on a technique called DIN, where we have distance, intermediate, and near by green technology, that's gradient refractive index, just like a progressive glass that we wear externally. This IOL has been developed in a polyfocal zone, where a progressive zone is made from the center towards the periphery. So there's no loss of light energy also. This is a large IOL, about 7 millimeters in size, the optic size. So this being a rigid PMMA, so this will be the first ever lens of a progressive lens, so-called progressive lens, which we call it as an autofocus lens, because we call progressive as a misnomer, where you have got diffractive and refractive gradient causing where the rings are present. So we did a study of a sample size of 40 eyes of 34 patients with 22 males and 12 females. We excluded the patients with corneal opacity, retinal disorders, and optic atrophy. And all the surgeries were performed with a 6.5 mm sclerocorneal tunnel, and the incisions were taken on the steep meridian to set right the astigmatism, pre-existing astigmatism, up to 1.5 diopters also. And these were the results that we got. So it is 612 to 66, and N vision, near vision was N8 and N6. No PC was noted in any of these cases because the large sized IOL, and it used to say have a full touch with the posterior capsule, and the mean follow-up was about 16 months. So this is the results of these IOLs, both the eyes in 18 months post-op follow-up. And this being a large sized optic, it does not interfere in any of the retinal procedures like laser photocoagulation in diabetics, and there is no double or triple diffraction of green laser spot if at all they need PRP in future. And this will be advantageous for people using for the indirect ophthalmoscopy for examination of the retina for treatment and surgery. And this is the IOL that is now going to be commercially promoted. We call it as $1 million optics, and the brand name is Solitaire. So these are the specifications with an optical A constant of 118.71 or 118.53. So the lens has advantages of no positive dysphotopsias, no glare, no halos, no waxy vision, photic phenomena, and we want to make it affordable to all the population, where the expensive foldable multifocal IOLs are the norm in the present day. In most cases, we had vision of 6 by 6 or better, and unaided vision of N6 at 12 to 14 inches. The patient was comfortable with computer vision with excellent from 2 to 4 feet, and women who were working on the kitchen platform had better vision for working, and even the patients who were needing work for, say, threading the needle in low light, even after bilateral surgery, this was advantageous. So the patient has very quick adaptation, even if the patient has been implanted with a monofocal IOL in other eye. So this IOL can be implanted in other eye also. We haven't tried it in a patient with multifocal IOL in the other eye. So I feel that this is everybody's birthright, because cataract does not know whether the patient can afford or not afford for a multifocal IOL. So this is going to be cost effective for the large population. Thank you for the patient here.
Now that most of the surgeries are converted to paper classification, do you all intend to make a foldable one also on this type?
No, so foldable is already made, and we have already commercialized it. So about 65 doctors who have invested in this company, and the foldable IOLs is made in a copolymer platform, and also the hydrophobic IOLs are going to come in future. So this is basically for an unaffordable population who are not able to afford the cost of the multifocal IOL at present. This would be costing between 1,500 to 2,000 rupees now.